In the past 5-6 years, all they bring is terminal dentition. They just don't recognize it. So these dentists may bring 5 to 10 just for that Friday course, which means God knows how many's already sitting in there.
Do you work with offices on like communicating to those patients? Because it is a hard conversation, especially somebody who's on a fixed income and all those kind of things of like, hey, I know your teeth work right now, but they're not gonna, you're sitting on a ticking time bomb.
If you're doing it in the operatory, your case acceptance is gonna struggle to get above 10-15%. That's not the place to do it. If you're doing it just with your patient, you're almost never gonna get case acceptance. You've gotta be doing comprehensive exam. You've gotta be getting all the radiographs. There's a scripting process we use.
Welcome back to another episode of the Full Arch Advantage podcast. I'm your host, Gary Bird. I'm the owner of SMC National, where we help you create, convert, and close more full arch cases so you can grow the way that you want. And today I have Dr. Brad, who's a specialist in prosthodontics, and he's the owner of Spectrum Dental. And he's going to be breaking down what he's learned after many, many years in the full arch business. And I promise you, this is one of the most value-packed episodes that I've ever done. Dr. Brad is a genius when it comes to both sales, operations, and marketing of his practice. Stay tuned. All right, we are live, and I'm excited about this conversation. Dr. Bradley, why don't you tell me what the number one thing that you're seeing that's helping people grow their full arch cases?
The number one thing that's growing full arch cases is really recognizing the patient that's sitting right in front of you. Through teaching through the years, there's so many patients who have terminal dentition sitting right there in their own chairs that they're just simply not diagnosing and or communicating well to them that they have a terminal dentition. These are their options, and then going through those solutions with them. You know, the vast majority of cases that we get are referred in. Many times they're terminal dentitions and the patients don't know it. And so, you know, that's a tough patient to convert because they think maybe they have a 1 or 2, 3 tooth problem when really it's a terminal dentition issue. And so
permanent, just for me, permanent, I Googled it, but the Google didn't give me the answer for me to be able to understand it. Permanent dentition means all of their teeth need to be removed.
Terminal dentition. So terminal as in end game dentition versus permanent. So it's a terminal dentition, meaning they do not have a good prognosis to restore the existing teeth that they have. And the main issue is the patients don't realize it. They know they have dental problems, but they don't understand that it's all collapsing. And so really our number one way to grow is we grow from referrals and we educate referrals. And there's a lot of patients that don't want to do full arch, or a lot of doctors that don't want to do full arch. And so they send them and we evaluate them. But without a doubt, it's really in a robust hygiene practice, the patients are really kind of sitting in there. So that's kind of our
every office. So
educating.
every single office, if I hear you correctly, every single office has patients that need full arch. The patients just don't know it.
That's right. Yeah. And that's a big segment. Now, a lot of your mass marketers are marketing to people who never go to the dentist, right? And that is getting it tapped into from external marketing. That hasn't been our main area of growth. It's the most challenging area of growth by far. By far, it's the hardest area for so many reasons. And so, but the number one thing we see is,
How do you tap into? So let's say there's a practice right now that's listening, and they've done 5 arches or 6 arches in their whole life. Those are all came from their existing patient base. They have let's say they have 3,000 active patients. How many patients are in that patient base that actually are going to need full arch? Are we talking 10, 100? Is it dependent on, I'm sure age plays a part in it. Like how do you start splicing that?
Yeah, the number one factor, you nailed it, is what is the age report of the practice, meaning the age of the patients. The more of that baby boomer population you have, the much more likely you have. That's theoretically a 1 in 5 patients going to have a terminal dentition at that baby boomer stage. You have a younger practice,
20%. So how I would segment that then, if I was like, this is the marketing guy talking, right? So It's like, okay, let's take your patient base. You have 3,000 patients. Great. How many of those are over 60? And so you go, okay, that's 1,000 of your patients are over 60. And then you said 20% of those
are have at least one failing arch. Yep.
Okay. So 20% of those. So that's going to be 1,000 patients. That's going to be 200 of your patients need some kind of full arch. And that's a lot. That's a big number.
It's a huge number. I've been teaching mini residency. And what that is spending about 4 full days a year with general practitioners. They bring in their cases. Really, in the past 5, 6 years, all they bring is terminal dentition. They just don't recognize it. So these dentists may bring 5 to 10 just for that Friday course, which means God knows how many's already sitting in there. The other thing you have to remember of those patients, a lot of that patient segment's not actually coming every 6 months, particularly the terminal dentition. So it's not like they're just showing up and saying they're there. They may be there every 12 months. They may be there every 18 months. They may be there and located as a patient of record, but they may only be an emergent patient. And so, 3,000 patients, that number, if you have an age practice, easily that's sitting in there. Now, that's still looking at, if you want to grow a practice from that aspect, I'm not going to say it's easy because it's hard to get those kinds of numbers to keep turning over. That's where people look to external marketing to kind of subsidize. And it just depends on what your goal is. How many do you really want to be doing,
Yeah, that's a great point. So I just ChatGPT'd it. What percentage of patients who go to the dentist are over 60 years old? And it said, ChatGPT said approximately 19% of dental patients are age 65 or older. So if you drop that down to 60, you can see. And if you have a little bit older of an office, you can easily get that into the 25% of your office is that age, right? Because I know a lot of GP is like family and things like that. So okay. So then do you work with offices on like communicating to those patients? Because it is a hard conversation, especially somebody who's on a fixed income and all those kind of things of like, hey, I know your teeth work right now, but they're not gonna, you're sitting on a ticking time bomb.
Voting is open for Dental Woo's top dental podcast. It starts on November 1st and ends on December 31st. Each vote supports the podcast. Last year, we won multiple top spots, and this year, we're hoping to do even better. This year, our goal is to get 1,000 unique voters on this podcast. Help us reach our goal, and your vote will count. Voting is easy. Just click the link below and find Dental Marketing Go, and then submit it. It's super fast.
Yeah. So a good number of the patients, and I can't really put a number on it, but it's very common. They say, look, my dentist has been saying they need to come to you for years, right? And they eventually get to the point where a front tooth falls out and now it's an immediate need and they've got to take care of it, right? Or they're at the point where they truly can't chew anymore. And so they come to us. They haven't met us at all. We have no rapport whatsoever. We do have the advantage of the referral. The referral may have given some level of numbers as far as what this can cost, but they usually severely undershoot it. And what that does is that actually hurts case acceptance overall. So then we get them in one meeting, and our close rate on any full arch patient pre-COVID was 82%. Post-COVID was about 91%. And so the close rate on a referred patient's very, very high, but we're not doing it on the first visit. This is not a first visit deal. It never is. There is a very, very defined system on how we communicate to these patients. But that goes for all of comprehensive dentistry. That goes literally for every aspect of it. And that's probably the single biggest nugget any general practice is missing, is this idea of how do I get case acceptance into my practice on anything? We say the number anything over 10 grand. And so, if you're doing it in the operatory, your case acceptance is going to struggle to get above 10, 15%. That's not the place to do it. If you're doing it just with your patient, you're almost never going to get case acceptance. You've got to be doing comprehensive exam. You've got to be getting all the radiographs. There's a scripting process we use. And then whenever we run their consult, we always have a significant other present, because a significant other is the one that actually decides the treatment. And the significant other almost always chooses the highest treatment. If it's left to only the patient chooses nothing or the lowest treatment. And that's just kind of the trend.
Because our loved one wants what's best for us. Right? Is that right?
Probably. We think the loved one wants what's best for us. The loved one, as we've found, also wants to do this one time. So they don't want the option that keeps them coming back to the dentist. Most of the baby boomer patients in general have experienced a lot of dentistry. And at this point, they're seeing a whole lot more visits. So one of the questions we ask is, how many times do we want to do this again? With the track
Well,
record of full...
they're also seeing more. Sorry to interrupt you, but they're also seeing the doctor more. So they're seeing the dentist doctor more, but they're also seeing their general dentist plus all the specialists. So their life is largely going. I mean, my dad's older. He goes to the doctor all the time. So anytime he like, it's just another thing that you're adding. So I totally get what you're saying. Like, how do I reduce the number of visits to the doctor?
Absolutely. You got to remember, with dental, there's no real insurance. You know, you go to the MD, you get the copay, but here you can get with all kinds of bills. And then, you know, the biggest power of full arch when done really well is its longevity. We can safely say, okay, based on literature, you put X number of implants in, or you put this kind of restoration, it should last you the rest of your life with minimal complication. There's really no other place in restorative dentistry that can say that above 10 years. And so, you know, that's the power of full arch for these patients. And that's what the significant other keys in on. They key on that. They say, we want to spend, get done, and move on. And that's the power there.
Wow. Okay. Yeah, that's really good stuff. And I totally agree with you. A lot of people focus on like, just get them closed right away. And it's like, no, there's a process to this. And I love your number on, you know, the 80 to 90% close. I have a question for you. Are most of the patients that are getting referred to you, do they already financially qualify for this kind of stuff at a high rate because they're being referred and they've already decided to come over, so then they're more qualified, versus like the people on the internet who are just Google searching this like crazy for the last 3 years, less financially qualified because they haven't actually dove into it? What are your thoughts on that?
Oh, I have great thoughts on that. So we're a 3-doctor prosthodontic practice. Myself, Ryan Mizumoto, and Mohammed Abdelhamid. And so the joke is, whenever we sit in a class when we're teaching, we ask the doctors, okay, how many of you refer to a prosthodontist? Nobody raises their hand. Okay, fine. If you were to refer to a prosthodontist, who would you refer? The crazy person with no money. So a heavy dose of this is when we get these patients, we have no idea if they're qualified or not. In 1 year, it was kind of a crazy year. This 1 year, 3 consults, 3 patients during the consult told me they just claimed bankruptcy. All 3 did a mandibular full arch at $36K combined fee. Okay. This is what we find. And this is true of just being in America. If you show them something they want, no matter what walk of life they come from, they generally find a way to get it. And that is, my mentality is, if you try to close first, you're going to swing and miss a lot, but it's also going to force your fee down. If you gain rapport and you meet the patient and you show your value, right, and you really educate, then your close rate skyrockets, number 1. And 2, you don't have to sit here and penny pinch on everything that you're doing. And so we probably treat a whole lot different. We probably put a lot more implants in than most people do, just because of the longevity in that. And so we do not pre-qualify the patients. We just want one thing: get them in our chair. And we put them into the case acceptance system we have. And by and large, we won. We've just started external marketing. Okay. And so we haven't had a lot of numbers. The one thing we found is we get a lot of dead end calls. We get no shows, but we did close the couple of patients we got to show up. So we were successful in that. But you know,
doctors always say that, just get them in the door and we'll do the rest. And it's like, okay, you're seeing that in real life. Like, you're actually seeing that. If you get them in the door, they close. And you said something valuable there. You said, we show them the value and then we educate. And the other way to frame that is, we show them the value and we explain to them the benefit to them, right? Because what I think happens a lot of time, Dr. Bradley, is dentists explain things that only another dentist can. They do it to me. I know a lot about dental for a non-clinician, right? But I don't know anything compared to you. And I have dentists all the time that explain stuff to me. I'm like, bro, I don't have any idea what you just said to me. Like, you just had a string of words. So I can only imagine when they talk to a patient, and they educate, but they're educating from their education rather than from the benefit to the patient. How do you think through that, or how do you make sure that your doctors don't do that side of it?
Well, you kind of brought up it was a landmark thing for me insofar as case acceptance. So we've been practicing about 20 years, private practice. And in the beginning, I was doing I usually had one full arch going, okay? So whatever phase it was in. And I published a lot. I love full arch implants, always have. And one day, I'm trying to educate a patient on what full arch is. And she's getting frustrated, I'm getting frustrated. So I sit and think to myself, and I'm like, okay, my scheduling coordinator was in there. I was like, Lori, Mrs. Jones just had one remade. Will you go grab her hybrid for me real quick? Just go grab it. She go grab it. I put the hybrid, the full arch restoration in my hand, and I put her denture in my hand. And I said, this is the difference. And it always stays in. And the number one biggest thing every single patient latches on when you show it side by side is the size of the restoration. You don't need to say anything else. I have story upon story. I have patients who swear they will not spend a dime on dental implants. The reason they got referred to us is because they refused the 2-implant overdenture. Oh, go to the prosthodontist to have your mandibular denture made. And they came over and they're sitting there and they say, I'm not spending over $15,000. I said, okay, well, I'm just going to do my job. Let me just show you what the other option is. And we simply show the model. We're going to put implants in here, but this is the restoration. And you show them a full-size denture and you show them a full arch, and all of a sudden, they're willing to spend because they want the restoration. You must create the desire. Nobody wants a full-size denture. When you see the size of that thing compared to a hybrid, it's a no-brainer. That was a magic nugget for us. It changed. People, we don't do overdentures ever. And the only reason we present it is to talk down about it it's a very expensive denture compared to full arch.
Yeah, this is in sales, and I know dentists hate sales, but for the people listening, they're like cringe when I say that. But in sales, there's a term called anchoring. And so and I'll explain it from a marketing standpoint, like if I'm selling you marketing services. So I'm selling you a package, and I want you to buy my $20,000 a month package for marketing, right, Dr. Bradley? And I already know you're going to cringe and roll up your shoulders at that number, like, because you don't want to spend, no one wants to spend $20,000 on marketing. So to get you anchored and get you to accept that number, I present you a $50,000 package, a $20,000 package, and the $5,000 package you get nothing with, right? And you see this all the time in threes. And you see it when you go to the movies for popcorn. They put it up. They put the giant tub that no one wants to carry, right? And it's like $40. And then you got the $18 popcorn, and then you have the $3 popcorn that won't do anything. So everybody picks the middle package. It's designed for you to pick. And full arch hasn't. We just had this conversation on another show recently. Full arch hasn't got to the place yet. Patients are just learning, like, there's implants, and then there's like full arch where you can get all the implants in, right? They're just now understanding it, which means you can start to do packages in your marketing. Like, here's the Cadillac that very few people are ever going to buy because it's the most expensive. And then here's the middle package, and then here's the lower package. And here's the differences between those. And one of them is the size, right? And so cars do this in all their trims, right? Cadillac has the best one. It's way overpriced. Very few people pick it. Then you have the middle one, which everybody picks, and you have the lower one that they use for marketing to get people interested. And everybody kind of picks the middle package. What is that? That's what you did. I don't know if you call it that or not, but that's what you did, is like you educated them through that. Do you think that full arch will ever get to the place where people can actually market that way and attract people that way and get them in? Or is it still, it's too hard because patients, because you're dealing with a patient, there's different qualifications of the patient and what they can actually have based on their health and whatnot?
Yeah, you make a great point. I'll answer that, and then I kind of want to go back. So, do I think we'll be able to market it that way? External marketing is challenging in the communication of that to people. I think you're going to need something higher than the full arch. And you're right, it's all crown and bridge, which isn't even better. I think well put it can, and I guess let me put it to you another way. Pre-COVID, when we would present this, we would always present in a terminal dentition, maxillary mandibular full arch, maxillary complete denture mandibular hybrid, maxillary upper and lower dentures, right? And I would tell everybody, and this was our statistics, 80% of our people took upper denture, lower hybrid. Okay. Of the other 20%, about 18% took double arch, and about 2% took dentures because we talked them out of it. Post-COVID, we're a vast majority double full arch. Now, the influx of money changed, people's priorities changed, everything changed, and we all went great gangbusters. However, right now, we are re-entering the world where people don't just come in with the wheelbarrow full of government money or wherever it was, and they're just going to say we're going to spend. So now, right now, I feel that we are getting back to pre-COVID as far as your skills to case present better be as good as they were back then. In an external approach, I still think it's, right now it's a very challenging game because it's a little bit of the race to the bottom on price, right? And I think those who haven't done this a really long time, I would just say the more you cut, small cases, small problems, big cases, big problems. And 60% now of what we're treating is redoing stuff from the last 2 years. And so there's a lot of that kind of stuff out there. So I would warn people about doing this price dropping stuff because you have to take it out somewhere, and that comes into the product. So external marketing right now has that kind of, people are wanting the fee. They don't want anything else. They just want the fee. And that's our challenge. We're not going to win that battle. Can you external market from a size percent, a high, middle, low? Yeah, probably. But I think it's kind of denture versus full arch. It may be. I don't know I believe putting something in the middle that wins, but it's a little more challenging here.
More challenging. Yeah. So, okay. So, here's another idea that I had, and I've bounced this off a lot of people. I haven't had anybody who's bid on it and said, run it for us, Gary. And I haven't had, I think it'll work. So right now, you brought it up, like you literally just brought it up, is that the biggest fear right now for clinicians is people are failing at full arch. So me talking with doctors, if I was going to get full arch, I'd be scared of who I picked because I don't want it to fail on me, right? In like 5 years or 6 years or whatever. And the failures are going up. And so it's a problem that the patients actually don't understand, because doctors don't talk about it because you're not allowed to, it's like an unwritten dental rule that you don't kind of bag on the dentist that messed this up, right? So what did dentists do? Well, it looks like they might have picked the wrong place for the implants or whatever, right? You know what I mean? Like in short, it's like, dude didn't know what he was doing. Like you literally paid $25,000 for somebody who didn't know what he was doing. So now you're going to pay $30,000 to get it fixed. And so now you're paying $55,000 for your full arch. Well, that's like marketing gold for me, right? Like, so in my brain, it's like, get a patient that's now paid $50,000 for arches, record them and say, tell their story. Like, hey, I went to the cheapest guy in my market and he placed arches for me and it was horrible. Like it worked for a little while, but then this started happening. And now I had to do it a second time. And to be honest with you, I hated it. But I'm happy I did it now because now I did it properly and I understand why it failed. And but don't be like me. Don't pay $50,000 by paying a discount, by getting a discount the first time. Just come to Dr. Bradley, you know what I mean, the first time, and you'll save $20,000. What are your thoughts on that? Because I think that I know that this is an issue right now because there's doctors out there that are just living on redos. So it's going to continue to be an issue, especially as more people run to the market.
I'll bite. I'll take it. I mean, that's what I had one of my new patients this morning. I mean, quite honestly, I'd say a lot of my hybrid patients right now are redo hybrids. I mean, we get a good number of them. Oh, I mean, just every level of failure you can imagine. And it's because of kind of the centers and things like that, we're seeing more and more of it. So I would tell you, we do, I would say more gently, but I have no problem doing it aggressively, is we have through Google and Google reviews said, you know what, will you just tell your story of how you started and where you are now and how that experience was. I do think there's going to be an exploding market of simply a billboard saying, are you having problems with your full arch? Call this number.
Yep.
I absolutely think that's going to happen. I think that um, at the end of the day, I don't think that you need to certainly bash somebody else, but I do think you need to be honest with them. Because at the end of the day, if you see something that doesn't follow academically some of the universal norms, and you as a diagnostic tool, that's something you have to inform them in. And there are tactful ways to do that. As a specialist and a specialist who sees and gets referred some of those cases that could be litigious cases, I think, thank goodness, we're not a terribly litigious environment. And I think that at the end of the day, I know we just want to see the patient move on and get it treated right. The sad thing is that, yeah, an early failure is bad and we don't like it, but most of the dentistry we see is failing. And so we're redoing that as well. And so unfortunately, I think you kind of have to put in the scope of rationalization. It's like, this is just an early failure and we need to move on. Certainly you always have to be careful of stepping on toes, but sadly we've got the publics getting a little bit, they aren't educated. That's just the bottom line. They're not educated.
They're not. And yeah, and it's sad because there's distrust. I mean, I'm in marketing, so we're distrust more than dentists. So I'll start with that. Yep. But there is an underswell of distrust if you go on social media around dentistry, and it's because it's so confusing. You don't really know. There's different ways to treat people. There's different, you can be aggressive, you can be conservative. That's when you're talking about general dentistry. But then you get into full arch and like people just don't understand, like, what in the world? $20,000 to bolt this thing on my head. That sounds crazy. And so there's just a level of distrust, and it's unfortunate, but I do believe that there is gonna, just like all other industries, there's like the top 10% are amazing. And then there's like the 80%, 75% middle class that are, they're all right. And then there's like the 10% bottom. But what I'm seeing in full arch is like the best are going to suck up a lot of the market because they're the best and they're so far ahead of the competition that it just doesn't really leave room for other people to really compete in it. And at the end of the day, I mean, why are doctors in the business to begin with? Like, you want to take care of people, you want to do an amazing job, but everybody has to learn on somebody. Is kind of someone's going to be somebody's first arch, right? Like that is going to be the case.
For sure.
There's no way around that.
No, that's for sure. Unfortunately, some of the stuff has become a bit of trophies, and procedure's not a trophy. I've had that say, I really want to do a full mouth rehab. Is, well, why do you want to do it? Is it just to do it? That's not really a great reason. And I don't think anybody would want to be that patient that's why they're motivated to do this. Obviously, specialists, you feel very strongly about getting appropriate education. One of the reasons full arch, I've published the 20-year and the 10-year publications on the long-term maintenance of these. And, the number one complication forever was acrylic maintenance. The prosthesis would break. In crown and bridge implant dentistry, it was PFMs and the porcelain rod fracture. And now we're making restorations where that force, which created basically a stress relief when it fractured, that's no longer there. And as we're under engineering, meaning putting less implants, but yet full Zerk prosthetics, things like that, we're going to see some of this force come out in other ways. We've seen restorations get profoundly more fracture resistant, and there are great studies on showing where that force goes. So the less the more underbuilt you are, the more that stress goes on to componentry and ultimately goes to the implants, which is the holy grail. And so that's one of the things that's more of a 5-year, 10-year. And that's where I think you're really going to see a massive explosion in this, is we're going to see, particularly in the maxilla, where these arches aren't built quite as sturdy, we're going to see a lot of failed implants coming out of there. We see a ton of prosthetic stuff right now, but I think the implant side's a wave yet to come.
Yeah, this has been really good. There's good stuff. You hit on a lot of points that I haven't thought through before, and did an excellent job of articulating it in a way that even I could understand. So I know for sure the audience is going to get it. So if someone wants to reach out to you and kind of learn about what you guys are doing and learn more about you guys, what's the best way to get in contact with you?
I appreciate it. Thanks for having me on, Gary. Best place to get a hold of me is email, B as in boy, Purcell, my name, Purcell, Spectrum. Then there's a hyphen, dental.com. You can reach me there on email, and I'd love to chat with you.
Awesome. Well, thank you so much for coming on. I appreciate you just sharing just what you've been through and what you're seeing, and the results are awesome. So keep up the great work.
Thanks a lot. Appreciate your time.